Wow, okay. My name is Jeff Ginsburg. I'm from Duke University. I'm one of the co-chairs of the Roundtable on Genomics and Precision Health. I'm joined by my co-chair, Michelle Penny, today, and we welcome you to what I think is the 27th workshop of this Roundtable over the last decade or so. So I guess our work isn't done. This one is on consumer genomics, and it promises to be a pretty exciting day. We certainly are very happy that all of you chose to spend your day with us today. I thought I'd remind us that Genetics and 23andMe were founded in 2006, 13 years ago. That was before the iPhone, which was in 2007. And of course, the concept of consumer genomics and direct-to-consumer genetic testing has evolved considerably over that 13 years. Navigenics and DecodeMe are no longer with us. 23andMe is here, as is Helix and Ancestry and a number of other companies and organizations that are directing genomic testing to the lay public. Nearly 15 million people have had genetic testing as a result of these technologies, these companies. I'd just be curious to know in the audience, just so we know who's in the audience, how many of you have actually subscribed to consumer-based genetic testing, either for yourself or a member of your family? Okay, so a fairly large group of early adopters. I would say that many have applauded this as a terrific way to think about how to engage the public in health literacy and their own health and health care. On the one hand, I would say that the provider community is a little nervous. Many of you who perhaps are seeing patients in the room maybe are anxious about the day that your patients will come in with their genomes and ask you to interpret it and to help guide them. But I think for the most part, our community and probably a broader healthcare community has viewed this as a positive disruptor in the space, but there have been others that have struck a more cautionary note. I've seen blogs that titled like "Think before you spit," or "Think again before you spit," or "Think after you spit," just sort of really raising potentially some concerns around what this might mean for healthcare and for the public. We had as part of at least our briefing materials, a British medical journal article that also had cautionary notes about direct-to-consumer testing that talked about false positives and false negatives and interpretation, but I frankly don't see why those are unique to direct-to-consumer genetic testing. It sort of comes with the territory. So I think today we're going to have an opportunity to look at the landscape of this continually evolving field and think about the implications for research, for clinical care, for reaching and giving access to the underserved and underrepresented communities. And also, I think the seminal question of how does this, or can this get ultimately integrated into healthcare? So I'm going to turn it over to our wonderful co-chairs, Greg Firu and Kathy Wickland. But I would note that on the agenda, there are two WANLs, in Section 1 and Section 2. Anybody know what a WANL is? Anyway, these are panels that are and sessions that are solely women. So we're really proud of the diversity that we're achieving in our workshops, and a trend that I'm sure will continue. So Greg and Kathy, the floor is yours.